Do you remember I mentioned that growth factor for the brain, the BDNF? We know that physical exercise increases BDNF levels. That's something, again, that you can do. People speak of feeling good after a run or feeling good after a session at the gym. They describe having a warm glow or feeling kind of energized. There's a reason behind it. We know that exercise increases BDNF, and we know that exercise also increases your serotonin precursor levels. So exercise is good, and as a start, that is what you will be asked to do for the mild to moderate. If the depression is deemed as going into the severe range, so you have all those symptoms and you're not functioning at home, you cannot get up to put a meal together, you're not going into work because you can't focus when you're at work, you're so wrapped up with guilt that you feel you're letting everyone else down, your doctor, whether it's a GP or the psychiatrist, would want to talk about medication. So I want to start off by saying all medication and all antidepressants do work. The difference is in their side effect profiles and your ability to tolerate them. So before we go anywhere, this is something you need to talk to your doctor about. So again, just some headliners on antidepressants. They need to be taken on a regular basis. You can't take them today and not take them for 3 days and they expect them to work. You need to take them regularly so that their levels in your blood build up and they cross the blood-brain barrier and start working on your brain. So it is really important to take them regularly. The antidepressant effects are not seen in the first few days that you take them. What you might experience are the side effects. It usually takes between 2 weeks, sometimes up to 4 weeks, before you will experience the beneficial effects of medication. Now, it is important that your doctor tells you this so that you're aware of it, because otherwise you're going to worry that it's not working. Your doctor also needs to tell you that in those first days and week, maybe, you may experience side effects, and the side effects depend on the type of antidepressant, and we will touch on that shortly. I always feel that if people know what they're going to experience, they're more able to tolerate it. For a first episode of depression, the recommendation from the National Institute of Clinical Excellence is that we stay on it for at least 6 months. If you had recurrent depression, the recommendation is that you stay on it for longer, possibly 2 years. In any case, my recommendation is that you need to have these chats with your doctor. If you're feeling fine having been on medication and you want to come off medication, go and sit and have a chat so that it is documented, it's monitored, and somebody knows what you're doing, just in case it doesn't work out. So you can always go back to them. Another point to note is, if you do want to come off your medication, please do not stop it suddenly. And I would just like to close up by saying, what can you do if you knew somebody who you felt was depressed? Talk to them, because someone listening to the person might be the first opportunity they have of talking about how they're feeling. Please don't say pull yourself together, because it's never that simple. And sometimes saying that to a person will make them feel very guilty and feel like it is their fault when it is not. Encourage them to talk to their doctor. People need to do it at their pace. You can't force people, but encourage them to talk to their doctor. Remind them that it's not a sign of weakness, that they're possibly unwell and they need some help. If you find that this person is using drugs or alcohol, kindly suggest that it might not be helpful. It might be the only thing they know to do, but it might not be helpful. If they are speaking of feeling that life is hopeless and they want to harm themselves, encourage them to get help. And maybe you need to get help for them on their behalf. The simple answer is no. However, when you've taken a medication for a while, and your life is going on quite well, there will be a psychological sense in you that you don't want to stop taking it because you fear that things are going to go wrong when you stop taking it. Any medication that you've been on for a while, coming off it needs to be managed sensibly with the help of your doctor, and that's what I would recommend. Antidepressants are not addictive, but coming off them needs to be managed. I touched on this earlier. It can take anything from 2 weeks to 4 weeks. And no, you should not take them just when you're having a bad day. They do not work like that. In fact, they will cause you more harm than good, because all you will get are the side effects without any of the benefit. Oh yes, it does. One would ask, what is a healthy lifestyle? It's all the normal things that you would do and you would advise your friend and neighbor. Having a regular routine, nutritious regular meals, regular exercise, activities that give you pleasure and happiness and stimulation. Having a healthy lifestyle is good for you, depressed or not. It's even better for you when you are depressed. The side effects vary with the medication you're taking. Commonly, people experience nausea. Sometimes they can feel agitated. Sometimes it can impact on sleep. Some antidepressants can affect sexual function, libido. It varies with the antidepressant and with the dose. So again, something you need to talk to your doctor about. I started this talk by saying that it is not your fault. Depression is a biological illness. And often, if you look at a person's history, they've had a lot of stress that has culminated in their depressive illness. It is an illness. You need help and treatment to get better from it. I'd like to end by saying medication does work. Depression is an illness. It's not your fault. And you owe it to yourself to look at doing everything that will help you get better. And though my focus has been on medication, there are things you can do before medication, such as ensure that you're getting good nutrition and sleeping well, such as regular exercise, and then seeing your GP to start discussions about medication. I wish you the best.